Welcome back from that Keep Fit segment, and I know you are joining to shake up some calories this morning. And next is our health segment. Every 28th July is celebrated as World Hepatitis Day, and that is why we have Dr. Sam Okorafor with us in the studio this morning to talk to us about hepatitis. Dr. Sam Okorafor is the Senior Registrar, Gastroenterology Unit with the National Hospital, Abuja. Sir, you are welcome to the program.
My pleasure. Good morning.
Morning.
Good morning, Nigerians.
Okay. And now, statistics from the World Health Record or Organization reveals that about 354 million people globally live with hepatitis infection. This is alarming and this is huge. What do you have to tell us about it?
Yeah, that's true. It's alarming, and actually I would say that is underestimated.
Wow.
Wow. Yeah, because that tells you the burden of hepatitis virus among us. Okay, is really on the increase, especially among children and underage. Is on the increase, so we cannot but lay emphasis on the burden of hepatitis. It's rising every day, and that is why the theme of today's World Hepatitis Year is Can't Wait.
I can't wait. I like that theme. I can't wait. I can't wait for what?
Okay. We can't wait for everything.
Okay.
We don't wait for our patient to come to hospital to be tested,
Okay.
whether they have hepatitis or not.
Okay.
Now, we want to bring the campaign of hepatitis closer to the doorstep of the patient.
Wow.
We want to take the campaign to healthcare facilities, to the communities, to the churches, to the mosques, so that we don't wait in the hospital for patients to be tested, whether they have hepatitis or not. At that time, we may have been advanced and we may do little or nothing to prevent it. We can't wait for pregnant women that are pregnant to be screened and treated so that they'll prevent the transmission of hepatitis to their children. We can't wait for those that are tested to get proper treatment. We can't wait for those that are on treatment to avoid stigmatization.
Wow.
We can't wait for the government and the policy makers to have the political will and funding for hepatitis. So we can't wait. We are taking it at the doorstep of the populations and the Nigerians. We want every Nigerian to know the hepatitis status so they can get adequate treatment and care.
Well, this is a very catchy theme for the year,
Yeah,
and
catchy.
the explanation you have given to it is so very, very awesome. Now, tell us the different types of hepatitis that we have.
Okay, currently there are 5 known well-studied hepatitis viruses.
Known.
Yes,
Okay.
known hepatitis viruses. We have hepatitis A virus, we have hepatitis B,
Okay.
hepatitis C,
Okay.
hepatitis D, and hepatitis E. They are named alphabetically, A, B, C, D, E. There is also hepatitis G,
Wow.
but it's not well known and studied. That was why I said 5 well known and studied hepatitis. 5th of April this year, there was outbreak of acute and severe hepatitis in central Scotland. In 5th of about that 10 cases were reported to the WHO. By 5 days later, the case has risen to 74 new cases. These ones have been studied, and we found out that they don't match to the well-known hepatitis. So tomorrow you can have hepatitis K, F, and G. So other ones are still under study, but the 5 well-known, as I said, are hepatitis A, B, C, D, and E that are named alphabetically. But there's chances of new ones being discovered and studied tomorrow.
Okay. Now, tell us the main causes of this ailment, hepatitis.
Okay. Hepatitis is a virus that affects the liver.
Okay.
It has predeletion for the liver.
Okay.
It can affect other organs of the body, but particularly it affects the liver. And our emphasis is not just about the hepatitis, but much more than that, the damage the virus has on the liver. And you know, it is a major cause of liver cancer. Not just major, number 1, about 90% of liver cancer cases are caused by hepatitis viruses, especially hepatitis B. And you know, liver cancer, the outcome of liver cancer is poor. So we are preventing hepatitis not just because of its own, but because of the health implication it causes on the liver, which leads to death, and the outcome is poor.
Leads to death. Well, tell us how it can be diagnosed and treated.
Okay. Hepatitis can be diagnosed through screening.
Okay.
Okay. It's just like there are, as I said, there are many types of hepatitis. We have the acute ones and we have the chronic ones. So our emphasis are those that run chronic causes, like hepatitis B, hepatitis C, and then D. So usually the patient will not have any symptom. So we don't wait for somebody to say, I have symptoms before we diagnose hepatitis. Okay. So it's by screening, it can remain in the body and you won't know that you have a hepatitis. So that is why we don't wait for them to come to us in the hospital. That is why we are going to the next step to screen them. So the diagnosis is by screening. There are blood tests that we do. Okay.
So we cannot say it's hereditary, or because you say you don't know whether you have it until you are being screened.
No. It's not a hereditary disease. But it's a disease that is transmitted from one person to another.
To another.
Yes, it's not hereditary, but there are lifestyle things that can cause it.
Okay. So the only treatment is for you to come to the hospital, get tested, and if you have anyone, it is treatable, right?
No. Not all of them are treatable. Currently, the only one that is treatable is hepatitis C. Wow. There is a cure for hepatitis C. So if you get hepatitis C, it's treatable. Hepatitis B for today is not cured. It's not curable.
But it can be managed.
Yes, can be managed. You have to be on medication for a long time. Ironically, well, I say it's the way God made it. So the one that is treatable has no vaccine.
Wow.
But the one as of today, but the one that is not treatable, that is hepatitis B, it has vaccine. So if people are screened early and they are negative, they can be vaccinated against it. So preventing infection and then the complication of liver damage that comes with it. Okay.
Is there any program lined up for today's World Hepatitis Day?
Yeah, the program lined up. In National Hospital, the gastroenterology unit, we organize a program in the hospital. We did an awareness talk. We did a free screening test in partnership with Mega Care. They provided us this kit. So we went around the hospital, shared flyers, talked to people about hepatitis, and then brought them to our clinic. We did free screening so that at least people will know their status.
Thank you very much, Doctor, for coming to talk to us about the awareness of hepatitis on ground. Thank you so much.
My pleasure.
Yes. We have been speaking with Dr. Sam Okora, for he is the Senior Registrar, Gastroenterology Unit with the National Hospital, and he has told us, do not wait until you are down with any ailment at all. Go for early diagnosis and you will be treated. Now let's go on a quick break. We'll be right back.
Are you interested in being